Good morning and welcome. On behalf of the American Association of Kidney Patients, I would like to thank those of you joining us here in person and the thousands of kidney patients and allies who will engage in this event virtually. We appreciate your interest in AAKP's National Kidney Patient Consumer Roundtable, highlighting the critical need to overcome government determinants of health. I would also like to recognize the sponsor of our program today, including CSL, Vifor, Bayer Pharmaceuticals, and Mallinckrodt Pharmaceuticals. My name is Ed Hickey, and as a kidney patient, I have the honor to serve my fellow patients as president of AAKP, the nation's largest and oldest fully independent kidney patient organization. I'm a Marine Corps veteran and an attorney based in Los Angeles, California. My professional experience includes posts here in Washington, D.C. as a senior aide on Capitol Hill and as a senior appointed official in 2 presidential administrations. Since 2017, I've also had the privilege to serve AAKP as the chair of our Veterans Health Initiative. This effort focuses on veterans and military families whose lives have been impacted by the unique burdens of kidney disease. The VHI supports continued veteran access to medical benefits they are legally entitled to receive. This includes the U.S. Department of Veterans Affairs' comprehensive and nationally acclaimed kidney disease prevention and treatment services. Through the VHI, I have the privilege to represent AAKP on numerous VA research projects, and in 2023, spearheaded a formal partnership between AAKP and the VA to collaborate on kidney care. AAKP represents the population of kidney patient consumers across all spectrums of kidney disease. Our members also include caregivers, organ donors, organ donor families, and allied medical professionals. We serve as a trusted voice for these individuals across every aspect of kidney policy, research, and innovation. Our national policy strategy is defined by 3 fundamental principles. First, we are committed to policies that expand patient consumer care choice and timely access to new diagnostics, drugs, and devices. Second, we advocate for and vigorously defend the trusted relationship between kidney patients and the medical professionals they choose for their care. We also work to find and limit negative interference in the patient-doctor relationships from third parties that lack kidney expertise, including insurers and at times even the federal government. Third, we reject the premise that patients should settle for status quo kidney care as the best America can do. Instead, we actively collaborate with all partners involved in advancing kidney research and innovations that will save more lives through better prevention, intervention, and treatment. Through this principled lens, we elevate policy and coverage issues based on their impact on kidney patients and kidney medicine. We believe kidney disease is both a healthcare and workforce issue. We also believe it is imperative for government to put the long-term interests of both patients and taxpayers at the forefront of all decisions related to kidney disease, especially when lives and livelihoods are at risk. In 2019, AAKP declared the coming decade as the decade of the kidney. We work to broaden public awareness of kidney disease and to maintain the national bipartisan commitment to prevent avoidable suffering and to find cures. Since 2018, AAKP has conducted policy summits and roundtables to spotlight kidney issues of concern within the executive branch agencies and the Congress. In 2018, we also launched the first and largest voter registration program in the kidney community, Kidney Voters. This program has been tremendously successful and helps kidney patients and their allies use both their voice and their vote to hold their elected and appointed leaders fully accountable for the decisions they make on kidney care issues. Today, we will discuss several critical issues impacting patient lives in the future of kidney medicine. Unfortunately, some of these issues have been made even more complicated by what AAKP calls government determinants of health, or GDoH. What are government determinants of health? Simply put, they occur when federal agencies, either knowingly or unwittingly, lose sight of their primary duty to safeguard the vulnerable populations they serve, including kidney patients. Further, government determinants of health mean government has migrated from the role of problem solver and has instead become a barrier to improve clinical outcomes and an exacerbator of health disparity. To be clear, AAKP invests tremendous volunteer time and resources supporting patient engagement efforts across executive branch agencies and the U.S. Congress. We have great respect for the federal agencies, like the VA, and all U.S. civil servants who consistently include patient stakeholders in policy deliberations. In fact, AAKP was the first patient organization in the kidney community to recognize outstanding U.S. civil servants with a distinct public service award. However, when federal agencies ignore kidney stakeholders or dismiss legitimate concerns of vulnerable patients, AAKP has no fear or hesitation in mobilizing patients to exercise their rights within America's democratic process. Today, we are honored that our policy roundtable includes multiple subject matter experts from a wide range of disciplines. They are united in their focus on improving the lives of kidney patients, and they share AAKP's deep commitment to true patient-centered care. For our first discussion topic, kidney disease screening, how the federal government could uphold its commitment to patients and taxpayers for earlier kidney disease detection and timely intervention. We are honored to have a great AAKP friend and spectacular patient advocate, Dr. Susan Quaggin, joining us live and remote from Chicago. Dr. Quaggin is a past president of the American Society of Nephrology. She currently serves as the Charles Horace Mayo Professor of Medicine, Chief of Nephrology, Hypertension, and Director of the Feinberg Cardiovascular and Renal Research Institute at Northwestern University. Dr. Quaggin has presented at numerous AAKP education and policy events, including our inaugural roundtable on CKD awareness in 2022. She is internationally known for her research and work in diabetic kidney disease and new treatments to slow disease progression and kidney failure. Early disease detection, identification, and treatment is a very timely issue. As we speak, the U.S. Preventative Services Task Force, the USPSTF, a body of medical professionals appointed by the Secretary of Health and Human Services, is debating whether or not they will recommend kidney disease screening for U.S. communities known to be at high risk. AAKP knows what should be done, but we are not certain that will be done by this HHS task force. Dr. Quaggin, thank you for joining us this morning. I turn the floor over to you for some brief remarks before I pose a few questions.
Terrific. Well, first of all, Mr. Hickey, thank you very much for the introduction and for the invitation into AAKP. I'm absolutely thrilled to be here, and also want to thank those joining in person and virtually. And I'm very disappointed I'm not there in person. I had a meeting here in Chicago. Following up on your remarks, Mr. Hickey, I think I will just start out about providing a few statistics and numbers, and this is an area that I am very passionate about. In the United States, there's an estimated 37 million people living with kidney diseases, and 90% of those individuals do not know they have kidney disease. That's 1 in 3 Americans at risk of kidney disease. And one might ask, why is there this discrepancy in not knowing you have kidney disease? One of the issues is that kidney disease is silent until very late, and the symptoms can be very mild initially. We also know that individuals with kidney disease have a worse prognosis and an amplified risk of cardiovascular disease. There is an urgent need, as you've highlighted in your opening remarks, to detect earlier, to intervene earlier so we can prevent the progression of kidney diseases. One of the other questions that I often get, how easy is it to screen for kidney disease? And unlike many other diseases, in fact, it's really easy to detect kidney disease with a simple blood and urine test. As you pointed out, some of the issues certainly that exist here in the United States, the USPSTF, the United States Preventive Services Task Force, last visited screening for kidney disease more than 12 years ago. And at that time, the recommendation was that there was no evidence that by detecting kidney disease earlier, other than treating the blood pressure or the diabetes, the high blood sugar, there was nothing that we could do to intervene. So if you fast forward 12 years to today, all of that has changed. And in 2020, October of 2020, the FDA gave breakthrough status to one new class of drugs known as SGLT2 inhibitors that target the kidney. And this was breakthrough status for the treatment of chronic kidney disease with and without diabetes. Today, we have not only one class of new therapies, but a whole menu of new therapies that are so powerful that they have the ability to almost stop kidney disease in its tracks. You know, I like to do some back of the envelope calculations, and a very good friend and colleague, Dr. Adira Levin, made the estimate that if all eligible patients receive this new class of therapies, that's very simple to take, a once-a-day medication, you could slow the progression of kidney disease and prevent patients progressing to dialysis by as much as 15 years. And Dr. Kathy Tuttle, another leader in nephrology and diabetes in the United States, did a back of the envelope calculation that if this new class of drugs made it to all eligible patients with kidney diseases, you could save 500,000 American lives in as little as 2 years. You know, I also like to put it into perspective for those who may not be as aware of kidney disease. Imagine instead you were standing in front of a patient with cancer and you said, we have a new therapy here, a once-a-day pill, you take it, and your cancer diagnosis will now be extended another 15 years cancer-free. Or imagine if you were standing in front of an individual with Alzheimer's and you said, we have a new treatment that could prevent cognitive decline for an additional 15 years. You know, I like to say in kidney medicine, we don't need to imagine that. We have the tools, the new therapies today that have this powerful impact to slow the progression of kidney disease. So I am particularly privileged to be here today. AAKP is an incredible organization advocating for patients. I'd also like to point out incredible allies for health professionals in the kidney space, and also for other societies, the American Society of Nephrology, the National Kidney Foundation, and even the American Heart Association has now recognized that the great importance of kidney health for heart health. So I think, you know, as a physician and a nephrologist, I think the human factor, the case for saving lives and kidneys is the strongest one, and that should be enough for us to move upstream and implement more screening. But there's an additional argument, and that additional argument is a financial one. And I know our friends and allies on the Hill and the policymakers understand this. The cost of chronic medical conditions, chronic kidney disease, is huge for the taxpayer. There's an estimated 7% of total Medicare costs go for paying for dialysis in this country. The lost years of productivity, as you pointed out, Mr. Hickey, early on, is huge. So in addition to the compassion and the reason to save lives and kidneys, there's also a very strong financial argument. I'm going to close so that we can have a conversation, but in closing, I'd just like to reflect that I've been a nephrologist now for 36 years, and I have never been more optimistic about where we're headed. When I started in nephrology, there wasn't a single known gene or cause of kidney disease. Today, we have more than 200 known genetic causes. In addition to these new breakthrough therapies that I talked about for chronic kidney disease with or without diabetes, there are new therapies for many other forms of kidney disease, including glomerular diseases and genetic diseases, emphasizing that now is not the time to take our foot off the pedal for innovation or research investment, but it's the time to push further. So as I close, I would just like to ask everybody who's listening in, either live or maybe listening to a recording later on, please to join us. We need as many voices around the table. We need to say no to the status quo, as Mr. Hickey pointed out at the beginning. We have within our grasp now the ability to stop the preventable loss of American kidneys and lives. So with that, I'm going to close and again thank AAKP and thank Mr. Hickey and all of you very much for the opportunity to join you today.
Well, thank you, Dr. Quaggin. It's wonderful to see you and hear your optimism. And I picked up a little bit of a Canadian accent in there, so I'm going to dive into the Canadian system here. And given your professional history in the Canadian medical system, you have a unique perspective on how kidney disease screening is prioritized in Canada and the U.S. And can you tell us a little bit about the primary differences between the two?
Yes, sure. Thank you for that question. I don't think I have an accent, by the way, but I was born in. I'm happy to say that as of 2022, I'm a proud American citizen as well, and I live in Chicago now. But to your point, absolutely, we know there are differences in the health systems between Canada and the United States. And clearly, there are a lot of stresses on both health systems, so I'm not going to argue one or the other. But one thing that is done and has been a priority in Canada for many, many years since my training there as well is prevention. And we know that preventing chronic kidney disease has multiple payoffs, mostly for patients, families, for society. And there are priorities and national initiatives called the Kidney Check. And these are developed often in partnership with communities. So I didn't talk about the disproportionate burden of kidney disease in under-resourced and minoritized communities. That's true in the United States. It's true in Canada. And there are some incredibly successful cross-Canada initiatives in rural communities and in Indigenous communities where the incidence and the risk of kidney disease is much higher. These kidney checks, simple point of care, know your kidney numbers, know your kidney health, were developed in partnership with the communities, with their values. And not only does it detect kidney disease early, so these new treatments can make it to patients and prevent the progression of kidney disease, but it also allows patients to know that they've got healthy kidneys and increases the pool of potential living kidney donors. So there's multiple reasons why checking early kidney screening has positive benefits.
Well, thank you. I mean, we've seen similar progress with prostate issues and with colon issues in this country in early screening. The implementation, I take, of this sort of test will be relatively simple in the United States as well.
Absolutely. And I think, we know that because we have kidney mobiles where we go, into communities and can do hundreds of kidney checks, in an afternoon. We do that all the time. It's absolutely a simple process and inexpensive, but the payoff is huge.
And you say inexpensive, the cost is less than probably $1 a test, if that.
Just a few cents, yes.
Yeah,
Yeah.
pennies on the dollar. Yeah. Well, thank you. As a follow-up to that, can you tell us how disease screening and early detection impacts long-term research, and just as importantly, the trajectory of medical innovation?
Yes. So, I think in my opening remarks, I highlighted sort of the rapid pace of innovation from really having decades of no new therapies for patients or individuals living with kidney diseases to having amazing new powerful treatments. And many of those are now should be standard of care for patients with kidney disease and heart disease. And yet we're continuing to see this rapid pace of discovery with the opportunity not only to slow the progression of kidney disease and keep a patient off dialysis for that 15 years, but ultimately to find those cures. And I would like to emphasize we cannot stop or slow down efforts for innovation and implementation across the board. I think, again, we're going to see incredible payoffs with investment in research and ultimately to identify cures for many of the kidney diseases that we see today.
Well, and you touched on this a little bit in your remarks, but can you share your thoughts on how this type of screening would impact society?
Yeah, so, from my perspective, the most important is it advances patient health at the individual patient, but beyond the individual patient. So this would be population health. And in addition, I did touch on the financial benefits. We know that the cost of managing patients with chronic kidney disease, often accompanied by other comorbidities, is a huge burden of tax dollars. And being able to intervene early and prevent the progression to these very costly and costly on the individual patient as well. It's easy to see the math that it makes sense.
It makes perfect sense to me, and I'm sure a lot of others as well. And so one final question for you. If the Department of Health and Human Services and the task force decide against kidney disease screening for people at risk, do you believe that undermines our national commitment to move kidney care forward upstream?
Yes, I'm an optimist, as I pointed out, Mr. at the beginning. Maybe that's my Canadian coming out. I'm optimistic they're going to do the right thing and recognize that we cannot lose more kidneys and lives, preventable loss of kidneys and lives. And every single day we wait, we lose kidneys and lives. So I'm an optimist that we're going to see a new recommendation and again, call on as many allies and voices around that table to raise the urgent need for this earlier intervention.
Thank you, and I'm hopeful with voices like yours that'll be true. So thank you for your great insights, and AAKP is going to encourage the appointees on the task force to consider the full implications of their decisions. And for those of you in the audience, please visit the task force website to learn more about their purpose. And also, please watch Dr. Quaggin's previous remarks on early disease detection by watching the CKD Awareness Roundtable on demand. It's on our website. And links are available in the digital version of today's meeting agenda and can also be accessed by the QR codes provided, which is located on your screen for our virtual attendees and at the registration table for our guests. Thank you again, and congratulations on the American citizenship. It's always a pleasure to see you, and I hope you have a wonderful day.